It's, since we didn't have work yesterday, I guess today's my Monday.
No problem. I've got the recording set up, so you can go ahead anytime.
Okay. Well, my name is Lacy Foy, and I'm the Primary Care Office Manager here at the State Department of Health. And we recently brought National Health Service Corps back to the state. So we will be doing all of the National Health Service Corps students to service, recertifications, and new site applications. So those of you that have worked with us and Natalie Morrison at ISCA before, we will be transitioning everything over to me now. So I really hope that I make Natalie proud and do just as good of a job as she has done in the past. So I put together this slideshow just to give you an overview of everything you need to know about the National Health Service Corps, and I will be showing some links and different things like that just so you can have a good idea of where to go for information, or you can call me too. So my information's at the end of the PowerPoint. So first I'm going to talk about our state loan repayment because this goes hand in hand with NHSC. Our state loan repayment program follows many of the requirements that the NHSC loan repayment program requires. I put the overview in here. The short version of that is that we have a $600,000 per year grant that we make 30 awards with every year. We're currently in the second round of funding, and we have several spots left open that we would like to fill. We tend to slow down in the second round and then pick back up in the third and fourth round. So we still have about 7 spots left open. We are looking for providers that are in health professional shortage area designations. They have to provide full-time outpatient care, and they have to be in approved facilities, and they must serve Medicaid, Medicare, uninsured, and sliding fee scale patients. Our program is probably one of the most lax programs around, just because we are really focusing on retention of already in place providers. So we really want to make sure that we have those providers here for at least another 2 years before we start working on any recruitment. So if you have anyone, please send them my way. We are accepting applications on a continuous basis. So what that means is we won't be having application cycles like NHSC does. We will be accepting applications on an ongoing basis. So when we get an application in, we review the application for completeness. We use a scoring methodology that every application goes through and they receive a score. And then we let the applicant know what they're missing and if they actually qualify. If they don't qualify, we will send them a letter letting them know what is missing from their application or why they didn't qualify, and they can reapply at any time. So once a funding cycle comes around, we take a look at the applicants that we already have, and we look at the scores and the areas that are in the most need, and that's how we fund. A lot of times, once a provider receives the contract, they drop out, and because the requirements for the contract are pretty steep if the provider ends up defaulting. Now, we can make lots and lots of concessions for if a clinic closes or if a provider has a family situation, they need to move sites. They just have to keep in communication with us. I've included a link that has all of the information and application on it, and we really would like to keep providers that you already have in your sites here in the state. So please let me know if you have any questions. So the National Health Service Corps has been around since the late 70s. They mostly focus on recruitment and retention of already established health providers. They also do have a Students to Service Scholarship Fund, which students in school can receive a monthly stipend and loan repayment for all of their loans that they have in exchange for a determined amount of time practicing in an underserved area. The National Health Service Corps is funded by HRSA's Bureau of Health Workforce. Commonly, about 27% of BHW's funds go to National Health Service Corps programs. National Health Service Corps is dedicated to serving the public. Their main focus is addressing primary care shortages. The focus has moved recently to the opioid crisis, and there have been several different loan repayment funds that have been set up to address the opioid crisis. NHSC also ensures access to care for everyone, even those who are unable to pay. NHSC wants to prevent disease and illness and care for the most vulnerable populations. NHSC's impact reaches across the United States. There's about 13,000 providers serving 13.7 million patients. A large portion of these patients are in Indiana. There's about 4,000 total behavioral health clinicians. 35,000 clinicians serve rural communities. And the number of students to service that are in the scholarship program has increased every year. So there's about 1,400 students this year that are preparing to serve in the NHSC. Most of the participants serve their time at community health centers. Most of Indiana's NHSC participants serve their time at SQHCs and community health centers as well. We have 158 providers in the state. This number has jumped up significantly since last year. We have about 10 more clinicians this year than we did last year. The majority of them are serving in a behavioral health setting, and we were lucky enough to have 2 that were awarded with the substance abuse loan repayment, and that is one of the new loan repayment funds that were set up to address the opioid crisis. 46 of our clinicians are in primary care and 33 are in dental health. So the most important thing that you need to know is if you are a new site that is looking to apply for certification for NHSC. And so most of the rural sites, rural health clinics, critical access hospitals, and any community health centers will qualify, with the exception of the SQHCs and Indian Health Services. You have to apply. If your site is an SQHC, it's automatically given an NHSC certification, and you'll work with the Department of Regional Operations, and they will get the site certification going for you. So any of the SQHCs, you are automatically qualified. Any other sites, if you are approved, you are eligible to recruit much needed clinicians into your area. NHSC approved sites have to provide outpatient, ambulatory, primary health services in a health professional shortage area. If your site is not in a health professional shortage area, then it automatically doesn't qualify. One big thing to know about new sites is that if you are an SQHC, it's really important that you reach out to either myself or the Department of Regional Operations and make sure that you get the NHSC certification going, because this will allow you access to clinicians through the NHSC. Another thing that's really important to keep in mind If you are not a federally qualified health center and you work in a rural health clinic and you'd like to go after this certification, this is the only way that your clinic will be able to have an auto HPSA, which is the Automatic Health Professional Shortage Area designation. Most sites that are not NHSC certified have until November 29th to apply. And if you need assistance with any of that, just let me know. I can help get you started with that. So new sites and site recertification requirements are very similar. You must apply to become recertified every 3 years after the initial certification. And you'll get reminders in your email for this. And so if you get close to that time, the NHSC is really good about sending lots and lots of emails to remind you. For new sites and site recertifications, you must be part of a system of care that offers ancillary inpatient and specialty referrals. So for new sites, when you're preparing your application, you'll want to make sure that you have any MOUs or contracts or anything along those lines with ancillary inpatient or specialty referrals. You want to make sure that you attach those to your applications, because if you don't have those, that's an automatic denial of certification, and they have to be attached to the application. You'll also need to provide documentation that you will provide services regardless of race, sex, color, national origin, disability, religion, age, sexual orientation, or gender identity. And this year, the gender identity was added to this clause. And so if you do not have this in your discrimination policies, this is something that you'll need to add for any new sites or site recertification. When we do review applications, we actually look for each and every word in this sentence. So if each and every word is not in this sentence, it's an automatic denial. We will give you the opportunity to submit. Just in case it's an oversight, we'll reach out to you and tell you that not everything is met in this sentence, and we'll give you the opportunity to send in new justification. As I said before, you'll have to be located and treat patients in a HPSA. That's pretty easy. You just look on HPSA Find to make that determination, or you can call our office. And that is one of the first things that we look for when we do an application as well. You'll have to provide primary care services for medical, dental, or behavioral health. If you're a community mental health center, then you obviously wouldn't provide primary care services unless you're working on integration to primary care, which is really wonderful. We can help with that as well. We will need documentation of the services that you provide for medical, dental, and or behavioral health. So that can be something like a list of services that your site offers. You can attach that to the application. You'll also have to accept assignment for Medicare beneficiaries. One of the biggest portions of a site and new site recertification is not providing enough justification for sliding fee scale. So all sites have to provide services at a discount based on family size and income through the federal sliding fee scale. And when you submit this portion in your application, you'll need to include the chart that shows what patients are actually paying on your sliding fee scale under 200% federal poverty. And patients that fall under 100% FPL, you'll have to show that they either pay no money for the services or a nominal fee. And there's no real justification on what that nominal fee is. If it's really outlandish, then we would probably not accept the recertification, and we would reach out and find out why there's a large nominal fee. But mostly these run anywhere from $5 to $100. It just depends on how you do the nominal fee in your practice. For a new site, when you do the recertification, you are not allowed to use the NHSC signage. You have to clearly post that your site will not deny services based on a patient's inability to pay or deny services for any reason, and that a sliding fee scale is available to everyone. Once your site is certified and you receive an NHSC certification, during your recertification of the site 3 years later, you will be able to use the NHSC signage. But if you use the NHSC signage for this portion beforehand, before you've been certified, then the application will be denied. And I know I'm throwing a lot at you, so I apologize for this is a lot of information. So feel free to call me anytime and we can talk about any parts of this that you might not understand or you need clarification of. So the process for new site and recertification sites, the first thing that you'll want to do is download the site reference guide. And the site reference guide has everything that we look at when we are reviewing applications. If it's in the site reference guide and it's clearly written in the site reference guide and it's not included in the application, 9 times out of 10, the application is going to get denied. I have included links to all of the reference guides and web addresses in the presentation. When you go to the site reference guide, maybe. I'm just not having good luck with technology today. You'll want to make sure that you're looking at the correct year. Every year, there's a new site reference guide to include any information that may have been approved by the NHSC. This PDF is really long and cumbersome, so if you're planning on applying for a new site or doing any site recertification, make sure you give yourself enough time to read through here. There's new information almost every year put in this site reference guide. But this is going to be all of the information that you could possibly need. One new thing that sites are having difficulty with is the behavioral health checklist. So if you provide behavioral health services at your site, you will have to fill out a behavioral health checklist. And in the site reference guide, it will have step-by-steps on how to fill out the behavioral health checklist and what supporting documentation that you will need. Any documentation that you might need above and beyond the behavioral health checklist will be in this document here. It also has when applications are due, what sites should expect after submitting the application, which that is a pretty long period of time where you won't hear anything from the primary care office or from your DRO unless we need more information on your application. So, once you download the site reference guide, you can contact the Office of Primary Care and we can assist you with technical assistance. Or if you already have a working relationship with our Department of Regional Operations or DRO representative, Felita, you can contact her as well. And Felita and I, when it's site recertification or new site time, we usually spend several hours on the phone talking about new requirements. We go through a lot of the site applications together, and we talk about things that I may have missed that she'll need further justification on, and then we kind of come up with a game plan for those sites that we need more information from. Once you submit the application, it comes to the primary care office. We have essentially 21 days to review the application. If you don't hear from us within those 21 days, most of the time everything is okay. If you hear from us, please contact us back as soon as possible. because once we review the application and hit submit, it goes straight to the DRO. And the DRO is the one who makes the decisions, and she will make the determination if the application is denied or approved. Site application cycles open twice per year. New site applications open in the spring, and site recertifications open in the summer and the fall. And we actually had 2 site recertifications this year. So most of the time they happen in the late summer. So how to become an NHSC member. So this is really important for any of your clinicians that want to apply for NHSC funding. They must commit to working at least 2 years in a HPSA. For loan repayment, they have to apply for and accept a position at an NHSC approved site. So they can choose any of the sites that they want to go to. If you have clinicians at your site that would like to, that you'd like to have apply for the loan repayment, once you become a site, they are eligible for loan repayment. And they will create an account on the BHW portal, and they'll be able to name your site as a site that they want to work at for the next 2 to 4 years, depending on which loan repayment program they choose. For scholarship programs, those scholarships are awarded to students who are accepted, enrolled, and accredited U.S. school in one of the following disciplines listed below. And most of the students to service go into primary care. Some of them go into behavioral health, and those requirements I can send out also. So the loan repayment programs, there's 4 different programs, which is really exciting because the substance use disorder workforce loan repayment and rural community loan repayment were just funded this year. So we're really excited about that. The traditional loan repayment program, it allows clinicians up to $50,000 in loan repayment for a commitment of 2 years in an underserved area and at an approved NHSC site. The substance use disorder workforce is for recipients, and they will receive up to $75,000 in loan repayment. And their service is for a 3-year commitment, and that's the same with the Rural Community Loan Repayment Program. The Rural Community Loan Repayment Program is focused on retaining clinicians in rural areas. As you saw before in the presentation, we don't have a large amount of clinicians working in rural areas. It's gotten bigger, but the majority of clinicians work near urban areas. So this focuses on the recruitment and retention of providers in rural areas. Then there's also the Students to Service Loan Repayment. It is considered a loan repayment program, even though they do receive the stipend every month. I've included several links at the end of the presentation. There is a lot of general information, and to keep the presentation shorter and open longer for questions, I have just put the links on. There's so much information that a lot of times it can get really overwhelming, especially when new sites are applying. There's a lot of information that goes into the application. So I have included general information links, NHSC site information, scholars, loan repayment, and then the HPSA find link. This link is really the one that I included in here. You can look for designations based on health professional shortage areas and auto HPSAs. You can also look up addresses of HPSAs through this link, and then you can also look at medically underserved areas and medically underserved population designations, which allow for different incentives, including J-1 visa waiver and community health clinic program. You are welcome to contact me anytime. I know I kind of went fast through the presentation, but I wanted to make sure that I left enough time for anyone to ask questions, because I went through it kind of quickly, and there's just so much information that I want you all to know that you can call us anytime. I put my email and office number on the screen, as well as my mobile number. After the first of the year, we're going to be doing more site visits. And if you're interested in having us come and do a presentation or just come to get to know you, please let us know, because we would love to do that. There's several of us in the Office of Primary Care that travel, and some of you might know Britt Anderson and Britt Skidmore already. They travel to a lot of the sites in the state, and Natalie Lakefield, who is our designation specialist, and I will start doing state loan repayment site visits in the fall, because we'd really like to start building closer relationships with all of our sites in the state. That way, we have that relationship to give out information, and we really want to be the state's source of information for primary care and all of the recruitment and retention programs in the state. So that is all I have right now. And if we're able to open it up for questions, that would be great.
Sure, thank you so much, Lacy. And if anybody has any questions, you can either raise your hand and I can open up your microphones, or you can use the chat function to send in a question. I should be able to send you guys all a test chat so you see how that works. But yeah, if you want to use the raise hand function, please do, and I'll open your line. Or if you want to chat in a question, you can do that now. Lacy and I will hang on the line for just a minute if anybody wants to send any in. We do appreciate everybody's time joining us today, and we have recorded today's presentation. So if you want to share it with somebody, or if you just want to view the information again, we'll have that available on the Indiana Rural Health Association's YouTube page here in the next day or so. Or you can always email me and I can send that to you directly. This is Allie Orwig, and my email address is aorwig@indianarha.org. And I will share that in the chat right now as well. So again, we'll hang around for just a second and field any questions you might have. Other than that, thank you all for joining us.